everyone, and welcome to today's webinar, Diabetes and Mental Health, Exploring the Connection. I'm Rachel Reeve, Executive Director of Research and Science at Diabetes Canada. Before we begin, I want to take a moment to acknowledge the importance of the lands which we each call home. I'm coming to you from the traditional territory of the Haudenosaunee and Anishinaabe peoples. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this land home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. It is with great pleasure that I introduce you to our exceptional panel today. We will be hearing from two Diabetes Canada funded researchers, Dr. Carly Whitmore and Dr. Miranda Nakla, as well as registered social worker David Delio and Diabetes Canada's very own Senior Manager of DCAMPS, Lauren Linklater. Each of these remarkable individuals brings forth their own unique journey and insights as they all share a commitment to better understanding the intricate relationship between mental health and diabetes management. We extend our deepest gratitude to our esteemed panelists for joining us today. And to our audience, we sincerely appreciate your presence. It is through the collective efforts of dedicated individuals and partners like yourselves that Diabetes Canada is able to advance its mission. Your support enables us to fund vital research initiatives, offer invaluable resources to our community, and persist in our unwavering commitment to end diabetes. Thank you for your support. To start us off, here is Dr. Whitmore.
So thank you for the opportunity to be here today and for the support of projects like mine. My name is Carly Whitmore, and I'm a nurse, faculty member at McMaster University, and a scientist at the Center for Addiction and Mental Health. As a settler researcher, I respectfully acknowledge that we are gathered from the ancestral lands of diverse Indigenous people. I'm joining you today from the traditional territories of the Mississauga and Haudenosaunee nations, and within lands protected by the Dish with One Spoon Wampum Agreement. I acknowledge a debt to those who were here before me and honor their enduring connection to, caring for, and teachings about our earth, this land, and our relations. Today, I will share a little bit about our technology-enabled model of collaborative care that looks to improve quality of life and goals of care for people living with type 2 diabetes and mental health challenges. To start, I want to speak a little bit about how I came to this research and focus. My journey into research began at the bedside. I'm a registered nurse with clinical expertise in psychiatric and mental health care, and my early experiences in practice shaped my understanding of just how complex and interconnected people's health needs are, especially for those living with multiple chronic conditions. During my graduate training, I became increasingly focused on the concept of multimorbidity, the coexistence of multiple health conditions, and the deep complexity it brings to people's lives, to their care, and to the systems that we work within. My applied and my disciplinary focus led me to qualitative and mixed methods research in this work. And as a nurse and a nurse scientist and an educator of future nurses and interdisciplinary health leaders, my vision, both then and now, is rooted in transforming how we think about and deliver care, really moving towards models that optimize healthcare delivery and health and wellness. Together, all of this helps me to co-design, implement, and evaluate services that are more responsive to the real-world needs of people, especially those who have been underserved in current models of care. So how did I land on mental health and diabetes? In many ways, it was a natural progression. My clinical background provided me a front row seat to the lives of people living with serious mental illness, people who too often developed metabolic disorders like type 2 diabetes, sometimes as a direct result of the very psychiatric treatments that were meant to help them. I saw firsthand how siloed our systems of care are, where people are left to navigate between different care providers, different care settings, and even different care sectors to receive the care that they need. And it became clear to me that we are often leaving people behind treating either the mental health issue or the physical condition, but rarely both in a coordinated or meaningful way. What we know now is that there is a bidirectional relationship between mental health and diabetes. You can't treat one without addressing the other. And this recognition continues to drive my work forward today, that we need truly integrated care that doesn't ask people to compartmentalize their health or their body systems the way that our health systems do. So building on that interest in integrated care and supported by Diabetes Canada, one of the projects I'm leading is called Technology-Enabled Collaborative Care for Type 2 Diabetes and Mental Health, or TECH-DM. The model was developed to respond to the high prevalence of mental health concerns, things like depression, anxiety, and diabetes distress, that are common among people living with type 2 diabetes. These issues can have a profound impact on day-to-day life and make it more difficult to manage diabetes, even when people are receiving high-quality care. TECH-DM brings together a virtual care team, including those with primary care and mental health expertise, to deliver collaborative and technology-enabled support via a health coach. What's important to highlight is that TECH-DM is designed to work alongside existing diabetes care. It's not a replacement, and it's designed to use omni-channel technology, things like the phone, text messaging, and web conferencing, to ensure that technological literacy and access are not a barrier to engagement. The purpose here is to support people in ways that improve their overall quality of life and help them pursue goals that matter to them across their mental health and physical health domains. So rather than focusing specifically on clinical diabetes management, through this model, we focus on what people feel they need support with, whether that's navigating their distress, setting goals, or building confidence and connectedness in their care. What's really exciting about this model is how it not only offers integrated care, but also works to expand access, especially for those individuals who might otherwise fall through the cracks due to geographic, systemic, or social barriers. We first tested the TECH-DM model through a feasibility trial, which allowed us to examine how acceptable and practical this model was for both people receiving care and the care teams who were delivering it. What we found was that the results were promising. We saw high levels of engagement, strong satisfaction with the virtual care experience, and encouraging improvements in both mental and diabetes health outcomes. Participants told us that they felt seen, they felt supported, and they felt more confident in managing their health. And so based on this success, we've now assembled an interdisciplinary team to expand the model across Ontario. And while we're just a few months into our 3-year project focused on this broader implementation and evaluation, and while it's early days, our foundation is strong and the infrastructure is in place. But you don't have to believe me. I think one of the participants from our previous trial really said it best. It never felt like we were doing anything really structured. It was like having a chat with a friend, but that friend had all of this knowledge and this team of specialists to support her. It didn't feel like she was following an itinerary or that she had specific steps to follow. It was organic and specific to me, and I think that's why I was able to make some big changes for both my physical and mental health. Changes I've needed to make many, many years. None of this work is possible without the incredible team that I'm privileged to work with every day. I want to acknowledge Dr. Diana Sharafali at McMaster University and Drs. Peter Selby and Osnet Melamed at the Center for Addiction and Mental Health, to name just a few of the brilliant collaborators who bring their expertise and their heart to this work. A special thanks is also owed to patient partner Janice Forsyth, whose insight and lived experience continues to shape this project in meaningful ways. We're also very deeply grateful to Diabetes Action Canada for their steady guidance to ensure that the work remains grounded in what matters most to people living with diabetes. And finally, my heartfelt thanks to Diabetes Canada and to the donors who make this research possible. Your support fuels this work. And now more than ever, We need ongoing commitments to science and discovery. And I'm so grateful to be on this journey with all of you. Thank you for listening.
Hi, my name's David Delio. I'm a social worker at Trillium Health Partners. I work in adult diabetes. My journey with diabetes actually started in my family. My father was diagnosed with type 1 when he was 2 years old in the 1950s. Then my younger sister was when she was 3 in about the late 90s, early 2000s. And then I myself was diagnosed with type 1 diabetes in 2001, 2002. So it was kind of the last one in the family to be diagnosed with that. I think I had a kind of unique experience from my peers where a lot of my peers were the only one in their family or maybe the only one in their school living with diabetes. And in my family, it was very much always in the background or the foreground. Um, I would say my career in social work is very much inspired by my journey with diabetes. It started when I was a teenager. I worked at Camp Uranda when I was 16, 17 years old as a counselor and got the opportunity to work with a lot of children and youth who are living with diabetes. I think because diabetes was so prevalent in my family, it wasn't something that I often thought about. I definitely had like the highs and lows and the frustrations of like managing a blood sugar and doing school and wanting to hang out with my friends and wanting to be away from my family and spend, sleepovers and do all that. But I never really like thought in depth about it. And I don't think I thought about it a lot until I started going to camp and interacting with like my peers who were around my age. Um, so during that time, I really got an opportunity to work with kids, and I loved it. And I realized really quickly on, sorry, all teachers, wasn't really meant to be a teacher. It wasn't really into the educational side of things, but I think I liked the connection and the soft skills and helping people problem solve and work through those. And I kind of shopped that around at university fairs for a while, and I had someone tell me, "Hey, why not social work?" And I was like, "Oh, that's pretty cool. That's a good idea. I should check it out." So kind of checked out social work programs when I did both my undergrad and my master's with it, and loved both. I thought it felt really reflective of like what I was looking for and what I needed. I kind of then had the opportunity, worked in camps for a number of years, was a camp director for kids with type 1. Now have the opportunity to be a social worker working with people in diabetes. And very grateful for it. I think something that always drew me to the line of work and I think helped me understand my own diagnosis was like the factor of community and that building resiliency. I think for a lot of people with diabetes or any chronic illness, there's a sense of isolation that can often come of there's a lot more mental math and considerations that people living with chronic illnesses have to consider that other people who are healthy don't. When I was 13 years old, I realized that I needed a job with benefits to continue to pay for all the medical supplies that have given me this quality of health thus far. And I don't think that's a thing a lot of 13-year-olds are thinking about. And I don't think that's a lot of my peers are thinking about right now. I think people who often are healthy aren't thinking about their health. It's just something that kind of exists in the background. And it isn't until we experience a change in that we begin to consider that and to see how that might impact us or think about how it's going to impact us in our future. I think my life with diabetes and both my professional life has kind of made me realize that it's something that's another layer added on top of it. I think everyone has to go to school, everyone has to go to work, everyone has to buy groceries, everyone has to interact socially, right? These are all steps of life that every single person kind of goes with. And I think diabetes is another layer added on top of it, right? It's a consideration of if our job is very active, how is that going to kind of impact our blood sugars? If our mood changes when our blood sugars change, how is that going to kind of impact on that? And I think it's a lot. I think it's a pretty big mental toll. I think with it being an invisible illness where unless someone's seeing maybe the CGM I wear in my arm or the insulin pump on my hip, they assume that I'm healthy. And I think that's true of a lot of people living with diabetes. And I think when that assumption is kind of going on in the background, it can make people feel that they should be coping with it better, or that they don't need to talk about it, or that everything is fine, or maybe a comparison that it could be worse, it could be something else. But I think it's still a level of mental fatigue and something that the average person, is not always thinking about. And I think it's something that I'm grateful that in the work that I get to do now and throughout my time at camp is helping people like unpack those thoughts, right? And challenge those and pointing out the resiliency. I think my life with diabetes caused me to be a lot more independent from a younger age. I think it made me think differently. I think it made me think a lot more about the value and connection of community and its importance in my life and a lot of other people's life, and has really like motivated my career and continues to motivate me in my career. I'm very grateful that I think my lived experience can be of value to people in my professional experience. And I'm grateful to work in an area that I think is very niche. I think despite for the amount of people who are diagnosed with diabetes, I think the public understanding throughout my lifetime has become a little bit better about maybe what diabetes is or how it can manifest, but I don't think the understanding of how it impacts people is quite there yet. And that's something that I get to do every day in my job. And I think much like diabetes, some days it can be very challenging. But I think overall it really helps to build perspective and build like understanding, and build a sense of community. And that's something that I hope to continue to do throughout the rest of my professional career, and is something I hope I can be a part of in today's question and answer period. I'm really looking forward to it and hoping I can be a help where I can.
Hi there, my name is Lauren Linklater, and I'm the Senior Manager for our National DCAMPS program at Diabetes Canada. DCAMPS supports children, youth, and families living with type 1 diabetes in programs across the country. Now, I'm not joining you as a healthcare professional or a mental health professional or a researcher who's an expert in this field. But I myself have lived with type 1 diabetes for over 25 years. And not only do I have the privilege of now supporting and overseeing our camp program, but I'm also a former participant and seasonal staff member myself. So I feel that I can really speak to not only the experience that our DCAMPS program provides and how we've really leaned into supporting the mental health of our participants and our caregivers, and what that relationship looks like with our medical staff at camp throughout the summer, but also my own lived experience. Certainly, the mental health landscape has drastically changed since my original diagnosis. I myself even remember my mom setting me up with art therapy not long after my diagnosis, because in the small town that I grew up in, there weren't a lot of other kids at that time who maybe were my age or had the same interests. And I, at the time, didn't know, but was probably trying to figure out what this diagnosis meant and how it might change my life, my perception of the world, or how others might perceive me. Fast forward to a few years later, I had the opportunity to attend DCAMPS. And of course, while a lot of things have changed over that time, and certainly in over my decade of leadership experience with DCAMPS, I think what's really interesting is the community experience and support that it provides has remained the same. We know that young people are struggling and the world is hard enough as it is. But once you layer on a diagnosis like type 1 diabetes, that's a little bit more complicated. I look at even my own relationship with maybe food or the clinical experience and how that changed for myself as a young teenager. I was navigating things that my peers in school who aren't living with diabetes, how it was so drastically different. But when we look at the community and the experiences that we build at camp, what is uniquely beautiful is the opportunity and environment for growth, challenging conversations, challenging stigma around what those experiences might be or might look like from that peer-to-peer setting, or with support of those near peer role models, but also having the opportunities to navigate situations that are real life situations, like working together and relationship building and challenging conversations to really build that emotional intelligence and provide that continuation of care, regardless of what that diagnosis might look like for someone. But not to focus primarily on summer camp, our programming has also in recent years extended to family camps. And that is where the entire family unit, however that's defined, has the opportunity to join us for a weekend or a few days, not just for some camp fun, but we also offer adult or caregiver specific programming. And we've really leaned into mental health because we appreciate that the diagnosis impacts the entire family. And that can look like a formal session with a social worker, some of which are social workers who join our camp teams and our medical professionals, because, again, not uncommon for young people who have access to a social worker to be integrated as part of their diabetes care experience. But more specifically, looking at how that diagnosis impacts that caregiver experience and journey as well, because it's not a linear journey. And we know that it's navigating the emotional, psychological, financial, and just overall mental burden or load that so many of our caregivers feel. Burnout is something that is a topic we often hear discussed for people who are diagnosed with diabetes, but it's been really interesting and refreshing for us to challenge that and consider what that looks like for those caregivers as well. And while that's only one little topic, I'm so excited to have you all joining us here today. And I'm so excited and honored to be joined by this esteemed group of panelists. And I am just excited to continue the conversation and look forward to all the questions that you folks might have.
So I am Miranda Nakla. I'm a pediatric endocrinologist at the Montreal Children's Hospital and a associate professor of pediatrics at McGill, and as well as a clinician scientist. And I am happy to share with you some of the research we've been doing that's been funded by Diabetes Canada. So a lot of my work has been on transition care and that transition from pediatric to adult care. And as we know, or may not know, 15% of youth in North America that have a chronic health condition will require the transition to adult care. Now, when we look at the definition, and this definition is over 20 years old, it is a purposeful planned movement of adolescents with chronic medical conditions from child-centered to adult-oriented healthcare systems. So what does that mean? It means that this is an active process that should be beginning in early adolescence, that the healthcare service that we provide should be coordinated, it should be developmentally appropriate to the needs of our teens, and it should be uninterrupted. It also should help our teens in developing their decision-making and self-care skills. And another really important aim of transition care, or an objective, is to help support our families in knowing how to shift the diabetes care from a parent to an adolescent. The transfer, which is historically what we always think about when we think of transition, is just an event. It's just one component of transition care. Yet, knowing this definition, studies have shown that more than 50% of adolescents living with chronic health condition have inadequate support and services during the transition to adult care. Now, complicating this transition care are the changes that are unique to adolescence and emerging adulthood, which is also young adulthood, and as well as that shift in responsibility from the parent to the child. And we know that this developmental stage is a process of transition that's independent of a child's health status. There's hurdles of that shift of your support group that's away from your family and parents and towards yourself and peers, feelings of invincibility and participation in high-risk behavior, as well as managing other life stressors. These teens are making future vocational and educational choices, as well as maybe moving away from their parental home, changing schools, starting new jobs. And that is a stress enough, irrespective of living with diabetes. Now, why is this a high-risk period in type 1 diabetes? Well, we know that there's multiple challenges for adolescents and adults when they're trying to, they struggle with juggling multiple responsibilities. We know that there's challenges in keeping their glucose is stable, that treatment and self-care management is really challenging at this point. Attendance to your diabetes doctor is challenging. And as well, we know that there's a risk of long-term complication development during this stage, and as well in increased mental health conditions, increased risk of mental health. But what about the parents as well? Parents struggle with adolescence and young adulthood, irrespective if a child is living with diabetes, and diabetes adds challenges to this stage. Parents often face uncertainty of what constitutes appropriate involvement. They express distress over what are the health consequences of transferring responsibility to my child. There's often conflict with their adolescent around diabetes management. There's challenges with how best do I support my adolescent in developing their autonomy and skills and helping them become more independent gradually. And also, studies have shown that parents voice frustration at not being included in this transition process, and as well as our healthcare system in failing in supporting our families and in receiving guidance on what is their role in this transition care process. So there's a need for a stronger evidence base to help inform and implement transition care practices, not only for our adolescents, but also for our caregivers. And this is important because we know that parental stress has negative health implications for the parent, overall family functioning, type 1 diabetes management, and health outcomes. Parental support and encouragement can help to promote self-efficacy, diabetes knowledge, and glucose stability. And when we talk about self-efficacy, we're talking about one's confidence in their abilities to manage their diabetes. So this led us to a pilot trial that was funded by Diabetes Canada. And this came out of a trial that we've been conducting in adolescents. That was a group education trial for adolescents living with type 1 diabetes. And when we were recruiting families for this trial, the parents were asking, well, what about us? We need something to help support us. And that's where this study had come from. And this is as you can see here, is our team and our parent partners. So our research question, the overall, was, do group education for parents of adolescents living with type 1 diabetes improve this transition process? So we decided to conduct a pilot RCT. What that is a pilot randomized control trial of education sessions for parents to assess the feasibility and to fine-tune the intervention so that we could test this on a larger scale. So what we had done is we recruited 34 parents and adolescents were ages 14 to 16 from the Montreal Children's Hospital Diabetes Clinic. And I want to add that we were able to recruit these 34 parents and adolescents within 6 weeks, which showed us the need for this service. The intervention was 12 months. We conducted assessments every 6 months. And we looked at feasibility parameters that are such as things as recruitment rate. So how many that we approach actually recruited into the study, how many did all the sessions, how many did all of the validated questionnaires we had asked them. But for the full study, we're measuring what is the self-care management and using a validated measure of that. We're looking at clinical measures such as hemoglobin A1C, emergency department visits and hospitalizations, but also validated measures such as diabetes distress, family conflict, diabetes resilience, and a change in the balance of responsibility. We have 2 arms, so they are randomized to either an active arm or a control arm. And the active arm includes group education sessions. It occurs every 3 months at the time of the adolescent's appointment with their diabetes doctor, and it's over 12 months. They're in person, and they were in group, parents were in groups together to help in terms of peer support and to learn from one another. It was facilitated by our wonderful diabetes social worker and psychoeducator. These were the topics that were discussed at each of the sessions. And as you can see here, and I could talk more about it with the panel, but one component was adolescent development. One was about communication around complications and how to motivation for self-management with your teen. Another one was communication do's and don'ts, and how to deal with family conflict, how to facilitate effective communication, and lastly, on transition. Parents were sent home with handouts that were developed with our parent partners, and our social worker and psychoeducator were trained by our psychologist on our team, and we even developed a facilitator guide that can be used at other diabetes centers. We had parent engagement. Our parent partners were really part of our research team. The intervention itself is parent-driven, addressing parents' needs, and our parent partners informed the design of this intervention and recruitment strategies. I'll touch upon this really quickly. We had conducted pre-interview questions with families to understand what it is they were expecting. We had found 4 themes from the interviews with these families, and I really want to focus on theme 2. And what we found is that parents, this is what they were looking for, psychological perspectives on parents. One parent said, well, that adult cares be able to slowly erase ourselves, but up to a certain point. As for the rest, we do not stop being parents, but to let our adolescents to take the reins and a bit more, and to develop their sense of confidence or competence as it relates to their diabetes, and to stop panicking all the time. So if parents wanted to gain more confidence in helping to build their child's confidence. They also wanted a priority on teamwork. So they wanted to say, the takeaway that they wanted was to really understand how they can work with their team, and that their team can see them as someone who's on the same team as them and not trying to control everything. Our next steps is to analyze the intervention interviews of the group education sessions, analyze our other outcomes of the intervention, and then to fine-tune this intervention further so that we can conduct a larger study with more parents and caregivers, and then to eventually implement this into diabetes clinics. And I'm going to end here with a parent from the Get It for Parents who took part in the sessions.
J'ai vraiment beaucoup apprécié les séances avec Get It. En fait, quand j'ai accepté de participer au projet, j'avais vraiment aucune attente. Je me disais que j'allais partager des expériences là, avec mon fils, puis d'obtenir de l'information. Puis en fait, ça a été vraiment au-delà de ce que j'aurais pu imaginer là, comme bienfait de participer à ces séances-là. En fait, moi, j'ai un garçon diabétique de type 1 depuis, il est diabétique depuis l'âge de 12 ans, il a maintenant 15 ans. Et avec l'adolescence, on veut les rendre de plus en plus autonomes en tant que personne, mais également en tant qu'enfant diabétique, on veut qu'ils puissent s'occuper et devenir autonomes là, pour qu'à l'âge adulte, ils soient en mesure de pouvoir gérer et s'occuper de leur diabète par eux-mêmes. Puis, en fait, moi, la croyance que j'avais, c'était d'essayer de le plus possible le laisser avec la gestion de son diabète, puisque je me suis rendu compte, en fait, avec la première séance, ça a été vraiment une révélation pour moi, c'est de me rendre compte que non, en fait, c'était pas tout à fait ça, puis que je devais faire pour le supporter, c'était de plutôt lui demander, OK, comment que moi, je peux te supporter là-dedans? Parce que ils ont tellement à vivre de choses en tant qu'adolescents, jeunes adultes, à gérer tellement de défis et de nouvelles expériences que si on peut les accompagner dans la mesure où ils veulent qu'on les accompagne, bien sûr, à les aider à pour leur gestion du diabète, bien, que c'est correct de les aider, puis même que c'est essentiel de les accompagner là-dedans. Donc, cette façon de penser-là, ça m'a vraiment beaucoup aidé. Ça m'a vraiment comme fait réaliser une autre façon de penser. Puis ça a été vraiment quelque chose, un game changer pour moi là, dès la première séance. Par la suite, une autre séance, c'était vraiment, on abordait des situations là, qui allaient se présenter, là, par exemple, les voyages scolaires ou c'est leur premier party. Donc, puis ce que je me suis rendu compte, c'est que les parents, dans les séances, on vit toutes les mêmes choses, les mêmes inquiétudes. Et les conseils puis les façons de penser à des spécialistes sont vraiment tellement, ça apporte tellement, c'est tellement précieux, les conseils qu'on reçoit. Moi, je vais certainement garder cette référence-là pour le futur. Puis j'encourage tous les parents qui ont des adolescents diabétiques de participer puis de s'inscrire. C'est très enrichissant. Et des ressources comme ça, c'est précieux parce qu'il n'y en a pas dans le fond, dans notre entourage. Puis cette initiative-là, là, vraiment chapeau. Je vous félicite puis je vous en remercie. Merci.
So I'm just going to end on thanking the numerous research collaborators we've had, Diabetes Canada for funding this initiative, our healthcare professionals that facilitated these sessions and were so engaged in it, and our parent partners. And thank you to our youth and families.
Thank you so much, Miranda, and thank you to all of the panelists for sharing either about your research or your professional work within the field of diabetes, and especially your own perspective for those of you living with diabetes. We really appreciate everyone being here today. So I believe we're all here and ready to start answering questions from the audience. So thank you, everyone. And if it's okay, I'll start to pull them. I'm pulling from the chat, the Q&A. I made a couple submitted in advance of today as well. And so the first question I have here, and I'll kind of leave this to whoever would like to jump in, and it's focused on type 2 diabetes. And so this person's asking about, with respect to medical coverage and access to diabetes education, how does, I think, any kind of recommendations for somebody from a mental health perspective living with type 2 diabetes, or any challenges you can see that you want to speak a little bit to the challenges that introduces, both access to medical coverage and access to diabetes education resources?
Sure, I'm happy to jump in on this one. So I also want to preface this with, I know we probably have folks coming in all over the country, maybe other countries as well. So I work in the province of Ontario, specifically just outside of the Greater Toronto area. I think, like, first and foremost, it is not possible to discuss diabetes and mental health without speaking of the financial stressors that accompany it. I think the reality is anyone living with a chronic illness, type 2 diabetes or type 1 diabetes, it comes with an added expense that you don't necessarily budget for, right? You know, when we are operating outside of diabetes, or maybe for our peers operating outside of diabetes, that's not always a financial consideration that we have or that folks can necessarily plan for. And I think it is a very real factor in impacting folks' mental health because I think it is a stressor. And I think one of the most frustrating things in speaking with folks who, like, prior to doing this job, I've lived all across the country, British Columbia, Alberta. I myself live with type 1, as I mentioned earlier, and coverage was different in every single province. I still have the same diabetes, but my access to, I think, like, supplies and the coverage and the supports that were available were different, and that was very frustrating, and I think can really limit someone's mobility as well as their opportunities. I think in terms of, like, how to access programs, and I'm going to speak about this generally because, again, it does differ where you are in the country or if you're in a different country. But if you are connected to a diabetes care team, to a center, to an endocrinologist, like, asking those folks those questions, because even if they necessarily don't have a social worker on the team, they will be able to redirect you to services that are hopefully covered under the province. So, for example, in Ontario, there are various counseling services or programs, depending what you're looking for, that are covered. You will just need that referral form. So sometimes that can be done by your family doctor. Other times it might need to be done by a specialist. But I would say from the diabetes side of things, that can always be a good place to start to look at. If you are kind of going with, you're having your diabetes managed by a family doctor or a primary care provider, also checking in with those folks, and they'll be able to help you out with those referral forms.
Thank you so much, David. Those are incredibly helpful information. I saw there were a few links posted in the chat as well for more information and more resources. The next question is research focused, and I think I'll direct it to Dr. Whitmore, if that's okay. And this person's asking whether you can speak to any research that's been done that is related to the onset of diabetes after the addition of antipsychotics to a person's life. This person specifically referencing schizophrenia in a young adult. We speak more specific, more broadly as well as about antipsychotics and the link there.
Yeah. So what we know is that mental health care and diabetes care, as David was saying, are provided by different professionals, different settings, different sectors, and I talked about this. But what's challenging is that mental health and diabetes are not only deeply interconnected, but they're bidirectionally related. And so we see things like depression, anxiety, eating disorders, and symptoms like those seen in diabetes distress occurring at a high quite often. And where that becomes challenging is that people can, as a result of this, have impaired self-management. It can contribute to burnout. And reciprocally, fluctuating blood sugar can negatively impact mood and energy and cognition. And this reinforces. But to the point of the question, we also know that people who are living with mental illness like schizophrenia, bipolar disorder, are disproportionately experiencing metabolic conditions like type 2 diabetes. And this is often influenced by behavioral and lifestyle factors, so things like smoking and diet and alcohol use. But the relationship is further complicated by certain medications. So things like the atypical antipsychotics that we use in the treatment of psychotic disorders carry well-documented metabolic risks. So things like rapid weight gain, insulin resistance, and ultimately a risk of diabetes. And so what we know is that these effects can emerge quite early and are especially critical to monitor in young people and those who are experiencing a first episode of psychosis. And so if you look across emerging guidance, so the most recent iteration of Diabetes Canada's guidelines on diabetes and mental health, there's specific reference in these guidelines around regular metabolic monitoring, careful selection of antipsychotic use, as well as implementing lifestyle interventions alongside the treatment so that we can reduce this risk and really support long-term health. So a great question, complex and complicated, and lots of work to be done.
Thank you. Thank you so much for speaking to all that research. As you said, an incredibly complex field. And I think that the insights that you were able to share were incredibly helpful. So thank you. I think it's kind of sticking on the same theme. There's a question here about whether there is anyone on the panel, research pointing to a connection between diabetes and dementia, particularly when the diabetes is not when the blood sugar control is not well managed.
I mean, I don't know that I have the authority to really hop in with any level of expertise other than to say colleagues are doing this work. So a colleague at the Center for Addiction and Mental Health is leading some really important work in this space, looking at how insulin in our brains, which I say I'm not an authority because I didn't really even think about insulin in my brain. Insulin in our brains has risk and is known to be also related to cognitive challenges. And what we're seeing is dementias and cognitive impairment in later life. So can't necessarily answer the question other than to say, yes, there is research here, but lots to be done.
Thank you for that. And I think I'm going to building on that question a little bit. There's a question here about how, I think we've spoken a little bit about how living with diabetes can impact mental health. And then can we speak a little bit on the flip side about how does mental health impact diabetes management, and speaking about the bidirectionality of it?
I can kick this off. Again, not the expert in the field here, but looking to the incredible panelists joining me, it's clear that there is a connection. And I think that so often, at least again, in my experience, in that clinical experience, you are so stuck at feeling often like a report card and going of checking what that time in range is, what your blood sugars are, what's your carbohydrate intake. But while that can feel like a checklist, it's everything that's running through the brain and what those feelings are, and how I know that even for myself, looking at when I get my blood pressure checked has to change, because I know that I'm going in with a heightened sense of emotion and anxiety into those visits, because it feels like a report card in my adult care in adult life. So it's also making sure that we can sort of approach that and give that space and grace to really dive into that relationship. I think that's so important. And I think that that's something that we hear in the topics of discussion, especially around young people and navigating that stigma. And often, unfortunately, that misunderstanding of it's so much more than a blood sugar. It's so much more than the blood work. It's how people are going to perceive not just the results, but what it means for navigating that in this world now. So certainly, I think it's so important.
Can I just speak to that as
Mhm.
well? So one of the outcomes that we're looking at for the Get It for parents, but also the Get It for adolescents, is diabetes distress. So it's the psychological and emotional burden of living with and managing diabetes. And the other thing we're looking at is stigma, diabetes related stigma, which Lauren talked about. And one of the it is very prevalent in youth living with type 1 diabetes. So we have seen that in adolescents with type 1 diabetes, diabetes distress, almost up to 30 to 40% have diabetes distress as well. And the symptoms are quite similar to depression and anxiety, and can affect their self-management and glucose stability. And as well, we've seen that with stigma, that a large percentage of youth live with stigma related to diabetes, and this also affects their glucose stability, not wanting to check their blood glucoses in front of their friends, not wanting to give insulin before class because they're worried about hypoglycemia and bringing attention to it. And so those things need to be addressed in our clinical encounters with those living with diabetes. I think Lauren is absolutely right in terms of it's not just the numbers, and the clinic visit shouldn't be around the numbers, because particularly with adolescents, adolescents know what they need to do. Parents know, but you have this huge barrier of stigma, of diabetes distress that needs to be addressed before we do things in clinics such as adjusting insulin. And so I think we need to do a better job of screening for diabetes distress, screening for these mental health conditions, so we can address them effectively in our diabetes clinics.
Thank you so much for that, Miranda. And I think we'll put in the chat in a minute. The Diabetes Canada did an initiative underway we call Change the Conversation, and a survey about the social experiences of living with diabetes that speaks to a lot of what you just spoke to. And so it's really appreciate you sharing your research into it. I think maybe for anyone on any of the panelists, there's a question here about if there are unique considerations or approaches for different age groups or demographics when addressing mental health and diabetes management together.
I think one thing that folks often do, especially if we're looking at a clinical setting, diabetes can often be viewed in a silo, like removed of our lived experience. And I think not necessarily acknowledge like the correlation between other major life events we have going on. For instance, I talk to a lot of folks in my work who I would say are like hitting retirement age, and work has been like a very driving force for them for so long. And the routine has very much been, you go to work, you come home, you take care of your kids. And then one day work kind of slows down and maybe eventually stops, and your kids have moved out of the house and maybe life is looking a little bit different. And then they'll come to me and be like, well, it's so weird. Like my blood sugars have always been within this range. Like I've never really had an issue. Like I don't really notice any change, but all of a sudden, like I'm emotional eating a lot more, or, I'm noticing these spikes or these changes at this time. And I think a big part of my work is kind of like piecing together those other factors that might be going on in their life, right? Where like those are two huge lifestyle changes. And I think two huge like developmental changes that are going on. And I think we often view that for young people. I think we do that. We can acknowledge when kids are going to high school. And then I think that transition into pediatric to adult care, which I know is something that we still need to do work on. But I think if we even talk about like a lot of the research that's been discussed, we talk about that. And then all of a sudden, you kind of just exist for maybe 60 to 70 years of life. But meanwhile, there's a lot of other life milestones that are going on in there that can, I think, impact our mental health in both ways, right? Maybe starting a family is a really great thing. And that's a huge positive influence to our mental health. So I think like checking in what other aspects of our life might be impacting, and especially when a diagnosis is new, or maybe a diagnosis is changing. Maybe we're going from oral medication to insulin, and all of a sudden that's a pretty big change. It very much puts diabetes at the forefront of our mind all the time. And I think it can just kind of view the diabetes as like a single issue, where in actuality, there might be some like external factors that are both either like hindering that or maybe helping that, and we don't even notice, right? And I think when like acknowledging that, it can feel very overwhelming. And I often encourage folks, to do what you can. We speak of diet and lifestyle changes like it's something you can go to bed and wake up the next day and change. They're not. Those are habits and routines that you've built over the course of your life. And I think when we're kind of working to change those, like acknowledging that 40% of the work is better than 100%, right? And if we're hitting 40%, like what are those things that we can do to bring it to 100%? So it's kind of long-winded, but I would say, maybe checking in and acknowledging the other factors and like other changes that are going on, and how that might be impacting our mental health in both sides, because I think it has a relationship in both ways, right? It's not always necessarily negative. Sometimes things are going really great in our life, right? And we can acknowledge those and pull from those as strengths to improve our diabetes management and overall health behaviors.
Very well put. Thank you. I have a question here that I think it's either for David or for Lauren. And it's, what would you tell your younger self from a mental health perspective, looking back to when you were first diagnosed?
The $1,000,000 question. I can start, David, and please feel free to jump in. But I think my message would be patient and give yourself grace. It is not a start to finish, and that even though you might feel more comfortable or confident or empowered with your diabetes care, know that there will have to be times to take breaks and still ask for help along the way, even as an adult, knowing that I still don't have to do it all alone. Even if I want to, it might be stubborn. So I think it's acknowledging that there's always people, community, healthcare professionals. There are always people out there who will be in your corner. You just sometimes have to ask for that help.
That was really well said. I would just add, I think with I know I said it earlier, my experience was a bit different. I was the third in my family diagnosed with type 1. So I think by the time I was diagnosed, there was like a bit more understanding than what was typical. But I think like looking back, and I know this is rich considering that I've worked in diabetes for the better part of a number of years, is acknowledging that you do not always need to be the everyone's voice of answers, or I guess the spokesperson for diabetes. I would say one thing I've noticed as I've gotten older and I do this, I have a lot of great opportunities like this where I speak about diabetes, and I think my lived experience holds a lot of value. But in my personal life, believe it or not, I'm not talking about diabetes all the time. And I think that came from like a learning journey where like so much of my professional life, so much of my personal life, so much of that space was talking about diabetes and existing in diabetes, that sometimes it was nice to just have friends to like talk about movies with or music with. And I think that would be something like if I could tell young me is like, you don't have to give everyone answers for everything. Like you can explain as much or as little as you want. And that's something I tell to a lot of young people now. And I think I would tell to my young self as well.
That's really good advice. Thank you. And I have a question here. This might be our last question, depending on time. But from your perspective, those on the call, like how can family members and friends best support their loved ones who are managing mental health and and diabetes challenges?
I'll go really quick because I feel like I've monopolized too much time. I would say, and maybe this is like a harsher truth, but acknowledge that it's messy. I think we've done a lot of a better job of acknowledging what mental health and mental illness is on a broader scale. I think you're seeing a bit more representation, but I think for those who are living with it or those who are supporting it, it's not clean cut, right? It's not, if someone is living with anxiety, their behaviors are going to be this way. And I think we can acknowledge that it is messy and that it is challenging, much like supporting someone with diabetes is. And I think it is okay and should be encouraged to like ask for those additional supports, because I think that is a lot for one person to self-manage. It is a lot for one other person to help someone self-manage that. And it takes a lot of resources and it takes a lot of time. And I think to everyone else on this call is acknowledging, like, you know, if you are a healthcare provider such as myself, that like takes a lot of time, takes a lot of resources, right? So if you see someone who is struggling, maybe it's time to like pull in those other supports that we know or can bring in.
And then maybe I'll just add from a healthcare professional perspective is for us to at least acknowledge and ask about and screen for it when we see our youth and parents. I know one of our parent partners, sometimes felt that when, similar to what Lauren was saying, when they come to clinic, it's about the numbers and the report card, and that A1C is how well they're doing. And they, and the discussion would be focused on that rather than, they may not have depression or anxiety, but there may be these other, psychosocial or mental health issues that are going on in the background in their child's life that they wish would be addressed. And I think it's us just asking about that, and acknowledging that it can happen. And I think one of the things that our healthcare system does struggle with is having the resources to help support our families. And that's one of the things that I know that, if someone had said in the discussion about the adult care focusing on the numbers, but one of the things in adult care is that one of the barriers that they see is that they don't have enough mental health resources to help support their patients living with diabetes. So
Thank you for that. And I think kind of to build on that, there was a question in the chat that we won't fully get to today because I'm gonna wrap up here given the time. But somebody asked about how far in is the research into mental health and diabetes? And the short answer is we have lots of progress to make. And I think we've come really far and we'll continue to make progress. And today we talked a lot about the mental health load of living with diabetes and that experience. We didn't really talk about the biological mechanisms and kind of shared pathways from that perspective. And so I think before we wrap up today's webinar, I am happy to share that we have entered into a new partnership between Diabetes Canada and Brain Canada to further research into mental health and diabetes. And so this year's research grant program, the End Diabetes Awards, will include a partnership with Brain Canada to help us support more research into the connection between mental health and diabetes. And by this, we include shared biological mechanisms through to the mental load of living with diabetes. And so we're very excited for this partnership and all the great work that we will do together. And so to our panelists, thank you. And so thank you everyone for joining us today to discuss such an important topic. I want to extend our heartfelt thanks to all our supporters, our partners, and generous donors who have made today possible. To our partners and supporters, your collaboration and shared vision enables us to move our vision forward and amplify impact. Together, we are working towards our vision of a world free of the effects of diabetes. And to our donors, your generosity has provided the vital resources we need to drive our mission forward. Your contributions are not just financial support, they're investments in the well-being of our community. So we are deeply grateful for your ongoing commitment and support, and your belief in our work inspires us to continue striving for a world free of the effects of diabetes. So thank you very much to our 4 esteemed panelists for joining us today, for sharing your personal experiences, your professional expertise, and everything in between. We couldn't have done this without you. And so thank you, everyone. And we will be sending out a post-event email to all the attendees with a link to this recording, a brief survey, and an opportunity to stay informed and learn about future webinars. So again, thank you so very much.